India is suddenly suffering the world's worst coronavirus crisis that has crushed the country's healthcare system. But unfortunately, instead of being a little more cautious about political campaigning that's currently taking place in the country, the ruling party right now, Modi's party, has decided to go full steam ahead. So that is part of the reason why, likely, we're seeing such a giant increase in coronavirus cases in India. India crossed a grim milestone of 200,000 people lost to the coronavirus in a devastating surge of new infections. In a new global record, Indian authorities logged 360,960 infections in a 24-hour period, bringing the total number of cases to more than 17.9 million. India also reported 3,293 deaths, even as experts warned that many virus fatalities were going uncounted. By the way, as I mentioned, the high number of cases is likely fueled by the fact that there's all sorts of political activity and campaigning taking place right now. And what's also happening because of the high numbers of new coronavirus cases is the same shortages really that we faced here in the United States. Unfortunately, the situation in India is even more dire though. So India's hospitals have faced severe oxygen supply shortages as the devastating wave of cases overwhelms the country's healthcare infrastructure. Many Indians have taken to social media to crowdsource oxygen cylinders and life-saving drugs, or even plead for information on open hospital beds. And that's the thing, they don't have enough hospital beds. We certainly experienced how horrible that was here in the United States. I do want to go to this CNN report that really helps to illustrate how dire the situation is in India. Take a look.
I'm standing outside a COVID emergency ward at a top hospital in New Delhi. It is here that a lot of people have been coming and almost begging for beds and oxygen for their loved ones. If you look at all these cars starting from here, almost a dozen of them parked right outside this emergency ward. They're asking just for beds and oxygen, which they have been denied as of now because there are no beds available, according to officials inside this hospital. They're old people here. Old women, old men, there are even younger people who are gasping for breath in these cars. They're just waiting for that one lucky moment where they get a bed inside this facility.
I brought my father here. There are no beds. There are people, those are in the corridors, lying on the floor. And the very first question says that show your RT-PCR test. What is the infection rate? Am I carrying oxygen cylinder? So which I wasn't aware of. I thought this is what the hospital would provide.
Relatives of patients who are suffering from COVID-19 have been waiting for ambulances also to take them home, but these ambulances have been so busy getting patients here or to crematoriums that it's been extremely difficult for them to get their sick ones home after being denied a bed.
One of the images that's hard to forget, and it honestly reminds me of what we experienced in New York with dead bodies being piled on top of each other in the back of trucks, is how they're backed up in cremations for coronavirus patients who didn't make it. So I do want to warn you, the next video is difficult to watch, but it does again provide a devastating illustration of how bad the situation has gotten in India.
These raging fires will continue all day and through the evening. The surge in cases has been so much that there's a waiting really for these bodies to be put on the pyre by family members. There's a queue outside just waiting for the final rites to end for a family member who has died of COVID-19. One of the most heartbreaking scenes I witnessed was when a 27-year-old was picking up the ashes of his 49-year-old mother. His brother is still in hospital recovering from COVID-19, while his father has just got home after recovering from infection.
Much like other right-wing leaders in places like Brazil, in the United States under Donald Trump, you just have these politicians who are far more concerned about their political aspirations and their political careers than doing the right thing to keep as many people alive as possible. And that's certainly the case with Narendra Modi, who's the leader of India and his BJP party. I had mentioned the elections taking place, and I do want to give you some more details about it because, again, that activity that's taking place is creating super spreader events, and that's why you're starting to see this explosion of new coronavirus cases in India. While India has become the COVID capital of the world, the country is at the same time busy in the assembly elections in 4 of its states and 1 union territory. Most of these continue to be enacted in the politically crucial state, West Bengal, which India's ruling party, BJP, desperately wants to win. So again, we're talking about a Modi-led party that will stop at nothing to ensure that they win. And if that means that they're going to hold more of these political events and cause more of these super spreader events, then so be it. In fact, Modi has gone to extreme lengths to silence or censor anyone who's critical of his policies related to coronavirus. And this is what you get when you deal with self-interested right-wing narcissists who, again, are far more interested in doing what they want to do to maintain power as opposed to doing the right thing as leaders. And as far as the United States, there is some talk about providing raw materials to India so they can, produce their own vaccine. That's some good news. There's a little bit of concern though, because the United States still refuses to waive the patents for the coronavirus vaccines. And as a result, there are many poor countries around the world who want to be able to produce their own vaccine, who want to at least be able to produce a generic version of the vaccine, and they're unable to do so. The fact that the United States and the World Trade Organization still refuses to waive the patent tells you everything you need to know about how dealing with a global pandemic will be a failure if you think about profit motive above preventing deaths. And that's what's happening right now. I get it. I get that pharmaceutical companies want to increase their profits. They want to protect their profits. In many cases, they claim, oh, we're not going to innovate. It's just so expensive to develop all of these drugs, even though the government pays for our research and development. But we're talking about a global pandemic. You are not able to combat a global pandemic in a global economy unless you work together and put profits aside for a minute, just for a minute. Waive the patent. Once you do that, then I'll actually believe that the United States and the World Trade Organization is serious about effectively combating this pandemic. Otherwise, it's all talk. Raw materials, that's nice. But get rid of that patent. It doesn't make any sense.
Thanks for watching The Young Turks. Really appreciate it. Another way to show support is through YouTube memberships. You'll get to interact with us more. There's live chat emojis, badges. You've got emojis of me, Anna, John, JR. So those are super fun. But you also get playback of our exclusive member-only shows and specials right after they air. So all of that, all you gotta do is click that join button right underneath the video. Thank you.